Hello everyone, it's another TGIF episode of the Anti-Pharmacist podcast and I welcome you once again. I hope you had a nice week. Well, mine was okay to an extent, it was okay. I'm just glad that it's Friday, so TGIF everybody. Yes, so today, guess what I have for you? I have big news. Big news. Well, to some it may not be news, but to others who haven't heard of it, it's still news, right? Yes, and the news is the arrival of malaria vaccine in Nigeria. If you've listened to my episodes in the past, especially the one about importance of vaccination, I mentioned that the malaria vaccine is on its way, that it will be deployed in 2024. But we know that we cannot trust many promises in this country, right? Sorry to say, but it's the truth. But I'm glad that this promise has been fulfilled towards the end of the year. So I'm very glad, I'm very happy. Actually, the malaria vaccine arrived in Nigeria last month. Yes, a month ago. But the deployment is still underway, okay? And why do we need malaria vaccine in Nigeria? You might wonder. Did you know that Nigeria carries the highest burden of malaria globally? And it accounts for approximately 27% of global malaria burden and 31% of malaria deaths worldwide. According to World Health Organization World Malaria Report in 2023, nearly 200,000 deaths from malaria occurred in Nigeria, and it affects mostly children under 5 years and pregnant women. The national malaria prevalence was 22% in children who are aged between 6 months and 59 months. That's around 5 years old in 2021. And in regions such as Kebbi State, the rate is as high as 49%. That accounts for like the highest rate of malaria in Nigeria. So it is very important that Nigeria lays its hand on this vaccine so that it can help in malaria prevention and control. Of course, malaria prevention methods have been in use and existence in Nigeria in the past, like the long-lasting insecticide-treated nets, like proper waste disposal, the awareness we've been creating, like hand washing, hygiene and all of that. But those are not enough. Vaccine takes malaria control to the next level, especially in children who are more vulnerable, whose immunity are not that high or advanced. You understand? I know some people will say, yes, this malaria vaccine we are celebrating now has been deployed in some African countries like Kenya, like Ghana, like Malawi. Why is Nigeria so just coming now? You know that the malaria in Nigeria is on another level, looking at the statistics that rolled out earlier. So what those countries had was the RTSS vaccine. But what was brought to Nigeria right now is the R21 vaccine, which is claimed to have an higher immunity potential against malaria than the RTSS. Some people might even be wondering that why do we have to take vaccines? Vaccines are bad, blah blah. I've talked about that in my previous episode. Even 2 episodes I dedicated to vaccination, importance of vaccination 1 and 2. So you should go listen to that. Vaccinations are good for you. They have prevented diseases and prevented deaths globally for decades now since their invention. So you should not be averse to vaccination. Forget all those rumors about vaccines used to correct or control populations, vaccines used to transfer diseases. Those are not true. Vaccines are there to protect you against diseases, to boost your immunity. I doubt there is anybody who has given birth in Nigeria who hasn't given their children vaccines, because these are routine things according to the vaccine schedule for children. And these children, of course, they grow without any problem, don't they? Because if we neglect vaccination, very soon death rate will exceed birth rates, and death rate will be higher, such that populations will begin to dwindle. So why not just prevent all of that by preventing the disease from happening? Also remember that diseases take an economic toll on people, on community, and generally country. Prevention is better than cure. That is the simple thing. So please be open to vaccination. Do not be averse to it. Now let me quickly give you important information about this newly rolled out vaccine. I've told you that the one available for Nigeria is the R21 because of its higher immunity potential than RTSS. it was a bit delayed because of some logistics, okay? And it was brought in through the alliance of three bodies: Gavi, which is a vaccine alliance, a non-governmental organization; WHO, the World Health Organization; and UNICEF, United Nations International Children's Emergency Fund. And like I told you, this vaccine will be for children, okay? Of course, I mentioned in the statistics that malaria affects mostly children, right? So this vaccine has been rolled out for children between 5 and 15 months old. The reason being that the vaccine is actually in limited quantity, so it can't go around the children up to 5 years old. Or at least if those children in that first age range are captured, then more can be deployed for children up to 5. And did you know that malaria vaccine development has been in the works for almost 60 years now? It actually began in 1960s, but it wasn't successful until 2021, in which the RTSS, which is known as the Mosquito vaccine, was approved by WHO. So a lot of work has gone into this, a lot of money has been invested into bringing this vaccine to birth. And it is the duty of mothers now to take advantage of it and not let all this effort go to waste. Just like you take other vaccines that have been scheduled for your children, you should also take malaria vaccines, okay? I'm saying this because although malaria vaccine will be imputed into the immunization scheme of Nigeria starting from now, some parents with children that have finished their vaccine doses may have to take their children back just for malaria vaccine, okay? And it will be rolled out in batches, first in 2 states in Nigeria, which is Kebbi and Bayelsa. I told you that Kebbi State has the highest rate of malaria right now in Nigeria. So it is seen as a focal point, a distress point where the vaccine should be deployed to first because they need it more, alright? But subsequently, it will get to other parts of the country. Now, the vaccine will be given in 4 doses. 4 doses, just like other vaccines. You have the initial dose, then you have the booster shot, right? It will be administered first at 5 months, another one at 6 months, another at 7 months, and the final shot at 15 months of age to be able to offer full immunity for that child. So, if the child should get the first, second doses without the booster shots, you might not be totally protecting them against malaria. And this is not to say that once you have gotten malaria vaccine for your child, you should neglect other forms of malaria prevention. Those are still valid. They all work together. So you use your insecticide treated nets, you do your proper waste disposal, proper hygiene and washing and all of that to prevent malaria. You also finish your anti-malaria medicines whenever you get them for your child or for yourself to prevent resistance to the existing anti-malaria drugs. Those are ways in which we can control malaria in our environment now. Okay, the vaccine is just complementary, not replacing any methods we have been using in the past to control the parasite, which is malaria. I hope you understand. And please note that the vaccine is free. It is safe and effective. So please do not fall victim of anybody trying to get paid or collect money from you. It is free, alright? It will interest you to know that limited vaccines are available. Even now, like I told you, they are being deployed in batches. And as at now, about 2 batches of the vaccines have been brought to Nigeria, making it about 1 million doses of the R21 vaccine available right now in Nigeria. And according to statistics, over 7 million children are born yearly in Nigeria. So, if a child is to collect 4 shots, that will go round about 250,000 children. So the earlier the better. Take your child to the nearest vaccination point or primary health care center where you get your normal vaccine for your children to get their shots of the malaria vaccine. Okay, that is if you are in the 2 states and you are listening to me, Bayelsa and Kebbi. Let's hope that other states in Nigeria will get their own portions of the vaccine soon. But pending that time, prepare your mind so that when it gets here, you can go get your child vaccinated as soon as possible. Now, let me go to how the vaccine works. to close this episode. So this R21 vaccine that has been brought to Nigeria actually functions similarly to the RTSS vaccine, okay? But like I said, it gives stronger immunity against the malaria parasite than the RTSS, okay? And what it does is that it targets the malaria parasite before it gets into the red blood cell. Because when it gets into the red blood cell, it starts multiplying, and then the symptoms of malaria start to show, like fever, the headache, general feeling of tiredness, discomfort, and all of that. So the malaria parasite actually produces a protein. This R21 vaccine was made with that protein. This protein helps it to infect the liver, but now the R21 vaccine helps the immune system recognize and fight this protein even before any malaria parasite gets into your body. This way, it already gives your immune system like a sample what to look out for when that thing comes. So it prevents the parasite from establishing an infection in the liver. But to get full protection, the required number of doses must be administered. Like I said, do not take your child for one of the doses and neglect others. If not, there won't be full protection. And that is what I have for you on today's episode of the Antipharynxis podcast. I hope that now you know that malaria vaccine has finally arrived in Nigeria, and there's a silver lining to malaria prevention and control in this country. And I hope that you are open to taking your child or your children for vaccination. So what do you think about the malaria vaccine? Do you think that more doses will be brought in coming months or very soon? Or do you think that this is the last we'll see of the vaccine? Do you think that they will be deployed well? Of course, it's to 2 states. Do you think that enough children will get it? And what effect do you hope to see of this vaccine on malaria control in Nigeria? Please let me know in the comment section. Alright, I hope that you enjoy this coming weekend, and I hope that you are already in the Christmas period just like I am. This coming week will be in December, the last month of the year. Thanks be to God that we're able to witness this from the beginning of this year till now. And I hope that you have a nice Christmas celebration with your family. I don't think I'm wishing that too early, because in some countries you would think that it is December 25 already. Christmas is already in the air. So let's prepare ourselves for that, okay? And in some parts of the world, it's Thanksgiving. So I think that we should be thankful for something. What are you thankful for? You can also put that in the comment section, or you can just say that to yourself and just give thanks, like I do always. Thank you so much once again for listening. You know how to support me now by sharing, by following, by subscribing to this podcast, by commenting, by liking my posts on socials, on IG, LinkedIn, Facebook. And yes, there's big news, guys. Another big news. Antipharynxis podcast now has a Facebook page. So please, if you have seen my invite, please accept. Okay, it's a page now dedicated to podcast, separate from my personal page. So now, henceforth, all content of this podcast will be on Antipharynxis podcast page on Facebook. Please go visit, show your girl some love, okay? On IG, I have a page for the podcast already, Antipharynxis podcast. I have my email address, antipharynxispodcast@gmail.com. On LinkedIn, it's still Bemisola Adebisi Jose, okay? Do not just like my posts. I appreciate those that have been liking it, but please click and listen, okay? I don't take your time, and I give you good information about your health. I don't think it's any time wasted. It's a win-win for both of us. Support me. And on X, Fan Podcaster is the name there, okay? Go like my posts, repost, do all of that, or retweet as they call it there. Thank you so much once again. I think I've thanked you like 3 times, but you deserve even more. I can thank you a million times if you want. Yes. Till next time, stay healthy and God bless you.